Welcome to the Demonstrating Implementation Excellence stream of the SNOMED CT Expo 2021. My name is Yongshen Gao, and I'm Senior Terminologist at SNOMED International. I will moderate today's session. Please use the live QA in your AirTouch device to type your questions to the presenter. All questions will be answered at the conclusion of the presentation. I'm now pleased to introduce Sophie from the Charité University Medicine Berlin, one of Europe's largest university hospital, who will be presenting use of SNOMED CT in structured searches for COVID-19 studies and evaluation of suitability. Sophie, please proceed.
Thank you for the invitation and for the very nice introduction. My name is Sophie Klopfenstein. I'm a medical doctor and I'm working as a research fellow at the core facility Digital Medicine and Interoperability at the Berlin Institute of Health, as well as at the Institute of Medical Informatics at Charité Universitätsmedizin Berlin. I'm delighted to present today our work on SNOMED CT usage in structured searches for COVID-19 studies. As this work has been conducted as part of the NFDA for Health Task Force COVID-19, I will start by giving a quick introduction about the main NFDA for Health project, its Task Force COVID-19, and GECKO, an interoperable pioneer dataset for COVID-19 research. The presented results are mainly from our publication evaluating suitability of SNOMED CT in structured searches for COVID-19, which was published in May 2021. I will end by giving an outlook on additional work conducted after this first publication, current and future work. As said, this work was performed within the NFDA for Health project, a German research initiative established with the aim to develop a national research infrastructure for personal health data. NFDA for Health aims also to foster cooperation between different research communities. It aims to create the most comprehensive inventory of German clinical, epidemiological, and public health studies, while ensuring a high degree of interoperability. NFDA for Health facilitates data sharing and record linkage, while observing privacy regulations and ethics principles. It also supports harmonized and federated data analysis. In order to provide fair data, meaning data that are findable, accessible, interoperable, and reusable, established standardized vocabularies, terminologies, and ontologies such as SNOMED CT are required. Within the SARS-CoV-2 pandemic, the NFDA for Health Task Force COVID-19 was established in order to provide relevant information on COVID-19 to the scientific community. The task force built an inventory of German health studies on COVID-19. The task force focuses not only on clinical patient data, but also on public health consequences of the outbreak, and works closely with other national initiatives and institutions. The task force can be seen as a kind of sandbox for the main NFDA for Health project and provides a unique opportunity to learn about potential pitfalls and challenges. 3 interlinked web-based platforms were developed containing a central search hub for study-level information, Opal and Mika, both open source solutions enabling item exploring and browsing from survey instruments such as questionnaires, and a COVID-19 Zeek platform providing access to metadata, interrelated study assets, and further information on COVID-19 studies. The central search hub in the middle of the slides acts as a broker for the 2 other platforms. The 3 platforms enable together cohort and item browsing, access to study resources, but also harmonized COVID-19 research. We use the German Corona Consensus Dataset, or short GECKO, to evaluate the suitability of SNOMED CT within the NFDA for Health Task Force. GECKO is an interoperable dataset providing data items for standardized COVID-19 research. It was developed within the German National Research Network of University Medicine on COVID-19. Domain experts gathered information from different sources and materials and prioritized data elements before developing a consolidated dataset. GECKO specifies information to be collected on COVID-19. It contains 81 elements combined with 281 response options classified into 13 categories. Medication and therapy are two distinct categories, even if shown differently on the figure. Data elements were then mapped to several terminologies and standards, including SNOMED CT and FHIR. This ensures semantic and syntactic interoperability of research on SARS-CoV-2. To learn more about GECKO, watch the session of my colleague Julian Sass. In our publication, Evaluating Suitability of SNOMED CT in Structured Searches for COVID-19 Studies, two coders, both medical doctors with experience in medical terminologies, mapped independently GECKO using SNOMED CT. No mapping rules were established before or during the mapping process, and SNOMED CT was used to map each data element. After having performed the independent mapping, both coders discussed each individual data element and established a joint mapping version. ISO TS norm 21564, short MapQual, was used to measure the degree of equivalence between the data elements of GECKO and the target concept of SNOMED CT. The norm was used to rate the joint mapping. To quantify the intercoder agreement, percentage share of SNOMED CT concepts to the GECKO dataset, equally chosen by the coders, and nominal Krippendorff's alpha were used. As a further evaluation of intercoder agreement, different mapping choices were analyzed and split into similar and non-similar concepts. 205 data items have been identified within GECKO. We excluded response options representing simple yes, no, or unknown responses. The joint GECKO SNOMED CT mapping version reached a high equivalence assessment score of 0.52. Each mapping concept received a rating score from 0 to 4 in order to calculate the equivalence assessment score, as shown in the table on the left side. The figure shows the high ISO TS equivalence assessment score by GECKO categories. It highlights that most of the GECKO items could be mapped to SNOMED CT concepts with equal meaning, defined as ISO rating 0. On the next slide, I will present some examples for each category, 0 to 4. Out of 205 items, 141 data elements, or 69%, could be mapped with a SNOMED CT concept having an equivalent meaning. Here you can find two examples for this category. Dementia as a GECKO data item was mapped with the SNOMED CT concept dementia with the semantic tag disorder. Another example is the GECKO data item vital sign, heart rate, which was mapped with the SNOMED CT concept heart rate with the semantic tag observable entity. A rating of 1 was attributed to 16% of data items. Rating 1 is defined as source is fully included in target. Examples would be the GECKO data item laboratory test cardiac troponin, mapped with the SNOMED CT concept troponin measurement with the semantic tag procedure. Or the GECKO element has the patient ever smoked cigarettes, which was mapped with the SNOMED CT concept tobacco smoking consumption with the semantic tag observable entity. 11% of data items received a rating of 2, defined as source is partially included in target. Examples would be the GECKO data item respiratory outcome, which was mapped with the SNOMED CT concept dependence on ventilator with a semantic tag finding. 8 elements of gecko, meaning 4%, received a rating of 3, defined as source is mapped. However, there were many options. Source map is the best comparison rather than an actual correspondence. Many gecko items asking about several different concepts within a question were rated using this category. And only one item, symptoms other, couldn't be mapped at all with SNOMED CT. As not every item was mapped to SNOMED CT in the original gecko dataset, we compared only 144 items of the original datasets to the mapping of each coders. With regards to the intercoder reliability, we found similar matching percentages and Krippendorff's alpha between two coders. We found a match of 49% and Krippendorff's alpha of 0.49, comparing mappings of gecko and coder CV, and a match of 51% and Krippendorff's alpha of 0.50, comparing mappings of gecko and coder SK. When comparing the mappings of both coders, CV and SK, 58% of SNOMED CT concepts were matching, meaning they were identical, and 42% were not matching. A Krippendorff's alpha of 0.57 was achieved. Intercoder reliability might be interpreted as moderate. 86 data items, or 42%, were identified as not matching or non-equal. When evaluating the non-equal mappings of individual gecko concepts, we, however, discovered that 64 elements, or 74%, could be rather defined as similar. The concepts chosen were different, but they were related or similar SNOMED concepts. The table on the right side provides some examples. For example, the gecko data item type of ventilation, non-invasive ventilation, was mapped by one coder with dependence on non-invasive ventilation finding, while the second coder mapped the item using the SNOMED CT concept non-invasive ventilation with the semantic tag procedure. Our first publication showed that SNOMED CT was able to capture typical data elements used in COVID-19 studies. The joint mapping achieved a high ISO-TS equivalence assessment score, but the intercoder reliability between the two coders was moderate. A further analysis could, however, show that the majority of non-equal matches were rather similar concepts. Establishing mapping rules would be an approach to investigate because mapping rules have the potential to improve mapping quality and intercoder reliability. So what did we do after this first publication? Based on our first findings, we established mapping rules. The two coders mapped again gecko independently several weeks later with those rules and reached more than 80% equal matches. 100% were not achieved because of two reasons. Some rules needed some refinements, and also the coders didn't follow always closely all the rules. We also mapped further 8 questionnaires after a prior analysis of the items. We noticed that some rules were missing, so we added them. And we also noticed that the design of surveys coming from epidemiological or public health studies are sometimes different compared to clinical studies. We also tested the implementation of SNOMED CT and MICA and OPAL and faced unforeseen challenges. First, we can't use SNOMED CT release files in MICA and OPAL, and we need to fill in some YAML files. Second, SNOMED hierarchies can't be implemented, and items are currently only classified by semantic tag, as you can see on the right side. Each item can only be mapped using a single SNOMED CT concept. And lastly, MICA and OPAL don't support post-coordinated expressions. If you want to learn more about our current technical challenges, please look at the poster of my colleague Karina Vorisek. In conclusion, SNOMED CT could be used to enable detailed structured searches in COVID-19 studies. Establishing mapping rules is a good approach to improve the standardization and quality of annotation. However, we need to fix some technical issues to enable functionalities based on a detailed annotation, such as a faceted search. Using several terminologies might be also an interesting approach to enhance the annotation. Herewith, I would like to acknowledge that this work has been conducted as part of the NFDI for Health Task Force COVID-19. I would like to thank everyone who contributed to this study and thank you for your attention.
Thank you, Sophie, for your presentation. Can I ask that attendees give us a moment while we switch over from our pre-recorded content so that Sophie can address the questions you have been submitting live? Please note that this session will be available on the event platform for the next 3 months. Thank you.
Thank you.
Thank you, Sophie. Excellent presentation. Just remind our audience, if you have any questions, please use your QA, click the QA button on the right-hand side and type your questions. It's excellent to see Sophie's presentation because Germany actually is relatively new members of SNOMED International. So it's great to see already at work utilize the SNOMED CT for your clinical practice and analytic purpose. Can I ask questions? SNOMED CT, we also publish the COVID-related contents in one place, try to facilitate people to looking for the code. If they are not familiar with terminology or they are not having the lessons, because COVID code are free to use. And I don't know if you have utilized those code and any feedback to SNOMED International. How can we improve our work in this subject area?
It wasn't a big problem. We had just isolated cases where we didn't have a very precise code. So either we used a post-coordination or we used higher level categories. One example would be, for example, the detection of particular SARS-CoV-2 antibodies, which are in Gecko very precisely coded. So for example, you can find the immunoglobulin G detection, how can I say, either detected qualitatively or quantitatively, and it's not possible to map it so granularly in a SNOMED CT. So we use the code detection of SARS-CoV-2 antibody, for example. But in the most cases, it wasn't a problem because almost all symptoms are already in the international release of SNOMED CT. But we already saw that for further instruments, we missed some codes, for example, concerning vaccination products. So we couldn't code them as detailed as we wanted. So maybe a versioning more often than twice a year or would be better in such a particular situation like this pandemic.
Thanks for that suggestion. Actually, SNOMED International is launching the frequent release, and this year we call the soft launch. We really testing out the technical infrastructure to release the content monthly. And next year that will become official, and hopefully that will definitely help our users to get the content quickly, and in particular for the pandemic and other emergency, the code can be released quickly.
Probably also. Maybe just to add to this point, maybe like more versions, but also maybe a more frequent or faster request track would be also a good option. So when requesting new content, to make it available, even quickly, more quickly.
We aim for that. Yeah, we got 2 questions, and the first one is Jennifer. Thank you very much for the interesting presentation. And what have your experience as the biggest challenge?
So, to be honest, it was there were 2 big challenges. One of the challenge was to set up some rules, to have also agreement between coders, because sometimes it's very difficult to decide if you should code something with a procedure or maybe with the substance, because it's maybe one topic, but you can code it like differently. And the second big challenge, which we are also currently facing, is the technical implementation and the software we use. So we have this limitation that we can't use post-coordination, or that we can't code one concept in the source with 2 concepts in SNOMED CT, for example. So yeah, I think the technical challenges are bigger than the challenges of mapping by themselves.
Thanks for that. The second question we got from Jay Colin. A great presentation. Not sure if you're aware of, but the UK NRC has done a lot of work on the representing lab results in SNOMED CT, even around the COVID. It is available as the unified test list. Are you aware of this, or if not, and he's happy to share that, because Jay Colin has involved quite the work with NHS on this subject area.
Yeah, to be honest, I wasn't aware of that. We use the international version of SNOMED CT because we don't have a German version yet and no national release yet. So I would be very happy to connect and to get those information, yeah, for sure.
Great, thanks. Actually, this also reminds me about the one initiative SNOMED International has been working on, is about a community area. It's not only just say we start a fresh new content area to work on. Also could be, the certain content in national extension could be useful for others. National extension can be shared through the community area, so therefore become easy and visible. Because it's not easy. You can go to looking at other national extension unless you do that on a specific purpose. But make that as a public available in the community area, maybe that is a possible approach. Yeah. We have another question. Okay, so, still from Jacob.
It's noted.
Yeah. Of course, the advantage of SNOMED CT community is about sharing experience, content, release. Find me in Meeting Hub or LinkedIn. Yeah. Yeah. Thanks, Jay. Yeah.
Yeah, thank you. I mean, what we are currently doing is mapping further instruments, and not all those questionnaires or instruments are medical questionnaires, but more maybe asking about epidemiological or public health topics. And yeah, face some challenges because some questions are asking about several concepts within one question, and so the mapping is very difficult. So analyzing the wording and so on are also a very time-consuming but very important task before mapping. And I think clinical content is not so difficult to map with SNOMED CT, but when it comes to other domains which are close also like to healthcare delivery, it might be more complicated.
Thanks for that. You mentioned about, in your presentation, at the moment you still cannot utilize the SNOMED CT hierarchy. Is that purely just the technical limitation at the moment?
Yes, it is. So we are currently working on adapting our software to make it possible, because it's somehow a pity if you map it very, very detailed and in a granular way to not have it then implemented like this. So we are working on adapting our software and not adapting our mapping. Yeah.
Thanks. Yeah. That does make sense, because when you do the mapping, you can only just look at a term match. Sometimes it may be too specific or maybe too general. But with the hierarchy, actually can help the mapper to look at the difference and to agree on the level for the detail.
Exactly. It would enable better analysis and maybe widen also like your research area or questions. So that's why we're working on enabling hierarchies.
Okay. Yeah. You mentioned about some code can not easy to find the right code in SNOMED CT, although it's small number. I would encourage you to submit a request. You know, the SNOMED International, we have the request portal. You can submit a request to say you can't find this code actually has been encoded in your data collection, and it would be good to be included in the SNOMED International release, and so we can take on that by the content team. I think we covered all the questions. If no more, let's see, just a second. Yeah, Jay Kohler put a message there. Just a remark, comments. What are you describing about multiple concepts in a single file is a typical challenge. Yeah, with what the SNOMED CT would call the registries. Yeah. Thanks, Jay. Okay, I hope that covered all the questions. If you have any more questions, please reach out and with Sophie and share your experience. And also, as I asked, if you have any feedback to SNOMED International, how can we enhance the content coverage for COVID and any other area, please do contact with us. Yeah. Thank you. I think that's all for this session. No more questions.
Yeah, thank you for the invitation. I'm happy to connect and to share information and knowledge.
Thank you.